Hello there and welcome to this second stage of labour clinical skills tutorial. In this video we're going to be focusing on how to do hands-on delivery with the woman in a semi-recumbent position. First of all, you need to make sure that you've prepared the environment for birth. You need to make sure that you have all the equipment and medications that are required for delivery. You need to ensure that the room is warm and that there is an area ready to receive the baby. You should facilitate a calm and relaxed atmosphere and ensure that any emergency equipment has been checked. You should prepare your delivery pack. Whilst preparing and checking the equipment, you should be sure to maintain a strict aseptic technique. As part of your preparation, you should ensure that your delivery pack has all the equipment that you require. You will need a receiver for the placenta, some gauze balls or cotton wool, a sterile maternity pad, a disposable cord clamp, a second clamp or artery forceps, an umbilical cord scissors, a sterile towel, and a sterile drape. You should also have warm towels and a nappy, 2 baby identification bands, security tag, and what you would need to administer vitamin K to the newborn infant. You will also need some spare incontinence sheets, sanitary towels, and some clean linen. You should also have, just in case it is necessary, an episiotomy scissors, some local anaesthetic, and a needle and syringe, and also your oxytocic agent for active management of the third stage if it is indicated. You should also assess what personal protective equipment or PPE is necessary. You may need some extra based on results of an individualized assessment of the woman. However, you will definitely need at least an apron, goggles, gloves, both sterile and non-sterile. Throughout the second stage, you will continue to provide support to the woman. You should encourage her to adopt any position change that she finds comfortable. You should ensure hydration by offering regular sips of cool water. A cool compress to the forehead or neck may help. It is also useful to apply a warm compress to the perineum, as this has been shown to reduce the incidence of tears or other trauma. You should provide constant reassurance to both the mother and the birth partner, whilst maintaining maternal and fetal observations. When there are signs that the delivery of the baby is imminent, you should place an incontinence sheet underneath the woman, and this is just to maintain hygiene. At this stage you may decide to cleanse the perineum prior to delivery. You should inform the woman that you're just going to cleanse the area with some water or other cleaning solution. You're going to swab from the anterior aspect to the posterior aspect. You will then swab again on the right side and again on the left side. During the second stage, you should continue to monitor the fetal heartbeat every 5 minutes. You should listen immediately after the contraction for 1 minute and document this at least every 5 minutes. Next, you should place a sterile drape underneath the woman, and this is to help maintain a sterile environment for the delivery. Next, you are going to place a sterile maternity pad over the rectum, making sure that you leave the perineum visible. Up until this point, you will have been encouraging the woman to follow her own urge to push. However, when you see signs that the baby's head is delivering, it may be useful just to ask her to pant to slow down the delivery of the head. You should place your fingers on the sinciput and apply gentle pressure to maintain flexion and to also slow down the delivery of the head. Continue to encourage the woman and try and get her to keep panting if she can. Again, this is to try and slow down the delivery of the head to minimize trauma to the perineum. You should apply gentle pressure to the pad to guard the perineum as the vertex advances, whilst maintaining flexion. Again, continue to encourage the woman to keep panting as the baby's head delivers. Once the occiput has delivered, gently extend the head upwards and then sweep the perineum downwards off the baby's face using the sterile maternity pad. You should check to make sure that the chin has delivered and note the time of delivery of the head. At this stage, you should dispose of the maternity pad and take your hands away to allow for restitution. However, you should keep your hands poised as the shoulders may deliver quickly after this. You can see that restitution has now occurred. When the next contraction starts, you will assist to deliver the anterior shoulder. Encourage the woman to push when she feels the urge. When the contraction comes, place one hand either side of the baby's head. Gently guide the baby in an axial direction until you see the anterior shoulder. You should stop if there is any resistance and summon help using the emergency bell. At this stage, you should ask the woman to pant, again to slow down the delivery. Once the anterior shoulder has been released, you should bring the baby upwards following the sacral curve, and you will see that the posterior shoulder will now deliver. At this point, you can change your hands. You will move your left hand down underneath the baby. You should now deliver the body and limbs by lateral flexion using your right hand, and then catch the baby's buttocks in your left hand. Deliver the baby upwards onto the woman's chest onto a warmed towel and note the time of delivery. You should congratulate the new parents, and both the midwife and the parents will determine the gender. At this stage, you will dry and stimulate the baby and observe adaptation to extrauterine life, and be ready to take any resuscitation steps if necessary. Remove the wet linen and place the baby skin to skin, cover it with a warm towel or blanket, and continue to observe the transition to extrauterine life in this time. The care and management now moves into the third stage of labour. The management of the third stage of labour may either be physiological or active. At this stage, you should change the continence pad to maintain hygiene. You will constantly be monitoring for any signs of bleeding. You should apply the infant armbands and security tag. Continuously monitor for signs of separation of the placenta. And of course, you will need to complete your documentation. We've come to the end of this clinical skills tutorial on the second stage of labour. You should refer back to your lecture notes and also to your midwifery core textbook with regard to the anatomy and physiology, and also more detailed care and management of a woman during the second stage of labour. You should also refer to the relevant guidelines and protocols. Bye now.